Hello, my name is Dr. Matthew Mathai. I'm a consultant paediatrician at the Bradford Royal Infirmary, and I'm here to tell you about our new paediatric ambulatory care experience, also known as the ACE service. ACE is an alternative to a hospital referral or admission for children and young people in Bradford who are unwell. It provides care out of hospital in a patient's own home. The ACE team is made up of senior children's nurses from the Bradford Royal Infirmary community team, all of them experts in caring for unwell children at home. Each ACE nurse will work under the guidance of a consultant paediatrician based at the BRI, who will take overall responsibility for patients referred to the service. In Bradford, children account for around 25% of all emergency department assessments, and around 70% of them are discharged after initial observation. This suggests that they could have been managed in a different way, in a different environment. Only 5% of patients seen are eventually admitted to a hospital bed, and the majority of these presentations are due to conditions like asthma, upper respiratory tract illness, or fever due to viral infections. We know that most of these common childhood illnesses can be managed successfully at home in familiar surroundings where the patient feels safe and relaxed. Added to that, a hospital admission is not only very disruptive to family life, but can also be very costly in other ways too. In addition, we want to help parents and carers become more confident in looking after their children when they are sick. Having a trained and experienced nurse helping them to do this in the patient's own home will, we hope, bring about a transformation. The service operates from 9 a.m. to 9 p.m. every day of the year. The ACE team can take referrals from GPs, nurse practitioners, A&E and the children's department. Any child who meets the criteria can be referred to the ACE service, which is currently running the Wheezy Child Pathway, but this will be extended to include other conditions in the coming months. Once referred, the patient comes under the care of the on-call consultant paediatrician. They can then go home and will be called by an ACE nurse within 2 hours to arrange a same-day home visit within 4 hours.
Hello, come in. Take a seat for me.
This is Jack. He has asthma and has become unwell in class during the day. He attends the GP surgery with his mum after school, where Jack's GP assesses him and feels he would benefit from a referral to the ACE service for specialist management at home. The GP calls the ACE team before giving the family a leaflet explaining the service together with important contact details and safety advice. Jack goes home with his mum. The ACE nurse arranges a home visit by calling Jack's parents within 2 hours of referral and checks through some details before visiting. During the home visit, the ACE nurse carries out a focused assessment, which includes checking Jack's current symptoms, medical history, and an examination. She evaluates how well Jack has responded to treatment so far and gives his parents advice on how to care for Jack at home during this episode, how and when to give medications, for example, as well as information on what to do if Jack becomes more unwell. The ACE nurse also discusses a number of important issues with Jack's family, issues such as inhaler technique, a plan to manage future wheezy episodes, a review of preventive therapy, smoking cessation advice, or, if required, a referral to an asthma specialist. With the support of the consultant paediatrician, the ACE nurse creates a care plan for Jack. Before leaving, she agrees with the family that she will contact them by phone the next day, but reminds them that she can arrange a further home visit if Jack is not improving. Occasionally, a patient might be too unwell to stay at home, so the ACE nurse would discuss this with the consultant and arrange a hospital admission. Jack's family would have access to the children's ward at BRI 24 hours a day during his illness and would be given contact details for the ward. In the majority of cases, though, children will be able to stay at home. When it is felt that Jack no longer requires ongoing specialist follow-up, he will be discharged from the ACE service. The ACE team usually cares for a child for up to 3 days, during which time his GP will be kept informed of how Jack is doing under the care of the ACE team. The service is only for this episode of illness. If Jack becomes unwell in the future, he will need to make an appointment to see his GP again. But for now, Jack has been spared an admission to the BRI, and his parents now have the peace of mind brought on by knowing that help is only a phone call away.
We hope that children and their families and carers will have a better overall experience by not having to stay in hospital for assessment. Our experienced nurses will be able to take care of children in the comfort of their own home during their acute illness, whilst also providing advice to families on how to prevent and manage further episodes at home in the future. If you would like any further information about the ACE service, ask your general practitioner or practice nurse. Thank you for watching.